Polycystic ovary syndrome is a really common condition. It's considered one of the most common hormonal issues among reproductive aged women. Like 7% of the population has it, which might not seem like a lot, but that's a lot of women. One of the biggest challenges of working with PCOS is making sure that somebody recognizes that you have it. And PCOS it's not just like a disease that you can just do one test and say, oh, you have it. It has to be a constellation of a couple different symptoms, including irregular periods or cycles that are spread apart, having hair growth, acne, or elevated androgens, which can be androgens from the adrenal gland, something called DHEAS, or testosterone, which is made in the ovary, and having a lot of little tiny antral follicles on ultrasound. And some of the best ways to deal with PCOS is to make sure that, first I would say to make sure that you have an appropriate diagnosis. You know, if you have questions, if you have PCOS, and if it feels like people aren't really listening to you, or it feels like maybe, you've read about it on the internet and you think you have it and you have concerns, so definitely find, a clinician that will talk with you about whether you have it or not. Over time, PCOS has been treated with Clomid, and it's been treated with letrozole, and it's been treated with metformin, and it's been treated with surgery, and all these different things. But the standard of care right now, if there's no other fertility issues going on, is to get them on appropriate medicines to help with something called ovulation induction, which is helping them ovulate. And often the medications that we use for that, they're not fancy, they're not expensive, they're just pills. And if we can get people on them and get them ovulating, as long as there aren't any other significant fertility issues, a lot of times those patients can be pregnant within 6 months. And then some of the other things that have been really found to be helpful, a lot of patients with PCOS struggle with their weight, and even a mild to moderate weight loss can really lower insulin levels, which can kind of change the hormonal imbalance with PCOS and allow people to ovulate more easily. And so, the cornerstone of PCOS management can be diet and exercise, Femara, sometimes metformin. We do have a lot of success with patients with PCOS. Now, obviously, sometimes those patients need more invasive treatments, but a lot of them can get pregnant with simple medications too.